my name is Megan Kunze, and I'm going to be performing NG tube insertion and also removal. So I already checked the provider's orders. He has ordered me to put in the NG tube, and I've gathered my supplies, which are right here. And so I'm going to perform hand hygiene. Knock, knock. Hi, Miss Jones. Is it all right if I turn the lights on? All right, lights are on. Provided privacy. Hi, Miss Jones. My name is Megan. I'm going to be your nurse today. Before we begin, can I see your wristband? Would you mind saying your name and date of birth? All right, Tina Jones, August 10, 1997. All right, perfect. So the reason why I'm here today is because your doctor ordered me to insert a nasogastric tube. What a nasogastric tube is it's inserted through your nose and it goes all the way down to your stomach. And the reason why you're having this inserted today is because you're very malnourished. Your electrolyte levels are not normal, as well as your albumin is really low. So we want to give you some feedings temporarily, so hopefully we can improve your nutritional status. Do you have any questions, concerns? Is this okay with you that I continue? Do I have your consent? Okay, great. It's going to feel a little uncomfortable, but we're going to talk you through it, okay? I'm raising the head of the bed to a working height. And I'm also going to place the patient in high Fowler's position. All right, Ms. Jones, I'm just going to raise your head of the bed, okay? On some clean gloves. Alright, I'm going to lower this, and I'm also going to maintain standing here not to compromise patient safety. All right, Ms. Jones, I'm just going to shine a light in your nose to see, and I'm checking for patency as well as any type of deformity. Is there a nostril you prefer, Ms. Jones? Your right one? Okay, perfect. So it's patent that there's no deformity that I'm noticing. All right, Ms. Jones, I'm going to place this absorbent Chex pad on your chest just in case we spill anything on you so we don't get your gown dirty. I'm going to get my tape. So this is the tape that I'm going to use to secure the NG tube. And then also I have the tape I'm going to use to mark it once I've determined the correct length. Alright, I'm going to open my NG tube. All right, Ms. Jones, I'm just going to measure how long the tube should be. So it's from the tip of the nose to the earlobe, all the way down to the xiphoid process of the chest. So this is around the length that is appropriate for Ms. Jones, and I've marked it with the tape. Okay. All right, Ms. Jones, just a couple of other things before we begin. This is Katerina. She is my assistant today. She's also a nurse, and so she's going to hold the water cup. And so what you're going to do for me is when I start to insert the tube, I'm going to raise your head forward, and when you kind of feel it in the back of your throat, you're just going to start swallowing. So I'm going to tell you when to swallow, and you're going to just swallow, 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 swallow. And so what this is going to do is it's actually going to prevent this from going into your airway because we want it to go into your stomach. And so if you swallow for us, then this process is going to go a lot smoother, okay? So I'm going to tell you when to swallow, and then Katerina will hold it for you. So I have my water-soluble lubricant, and I'm going to place it on the tube. And this lubricant's just going to help the tube go down a lot easier, Miss Jones. Okay, I'm going to have you lean your head back, and then on the count of 3, I'm going to begin. All right, 1, 2, 3. Okay, it's past the nasopharynx. All right, Miss Jones, swallow, swallow, swallow. I'm rotating it 180 degrees. Swallow, swallow, swallow. Keep swallowing, Miss Jones. Okay. And typically I would go to this point, but the mannequin will not allow me to go any further because it's not a real person. So at this point, it should be to here. I would place this piece of tape on the nose, like this, and then I would wrap the tape around the tube to secure it. Alright, the tube is completely secure, and I'm going to use this syringe to check gastric or to check to see the pH. Hopefully if it's between 1 to 5 in the pH, I'm in the stomach, so this is a good sign. So I'm just going to pull out a little. I'm going to have my pH strip over here. I'm going to, great, the pH is 3, so we're perfect there. And then I'm also going to get one additional piece of tape. And I'm going to tape it to her gown so it does not get in her way. Just like that. And then also another way, because the checking the pH isn't necessarily gold standard, I'm going to also call the doctor and have an x-ray ordered just to verify placement. And we're going to want to hold those feedings until the placement is confirmed, just in case it is in the lungs or any type of other area. But it probably is in lungs because she wasn't in any type of respiratory distress when we inserted it. So I'm going to take off my gloves. I'm going to perform hand hygiene. I'm going to remove all of my supplies and throw them in the trash. And then I'm going to raise this up, lower Miss Jones back down to a normal position, and I'm going to lower her bed to the lowest position. And so one of the things I'm going to want to document is the type of tube I used as well as the size of the tube. Also, I'm going to want to note where the distal portion of the tube is, just to know where it's located. And then also I'm going to want to document how the patient tolerated the procedure, the pH that I obtained, as well as the fact that an x-ray was ordered, and then hopefully it's performed. And then I'd lower her, she's in the lowest position, and I'd leave the room. Hi, my name is Megan Kunze, and I'm going to be performing an NG tube removal. So I've already checked the provider's orders and confirmed that he does have an order for an NG tube removal. I've already gathered all of my supplies, which are right here. And then I'm going to perform hand hygiene. Knock, knock, knock. Hi, Miss Jones. Is it alright if I turn the lights on? Okay, great. I'm going to turn the lights on. I'm going to provide privacy. Hi, Miss Jones. My name is Megan, and I'm going to be your nurse today. Before we begin, can I please see your wristband? Would you mind stating your name and date of birth? Tina Jones, August 10th, 1997. Okay, great. So the reason why I'm here today is because your doctor has ordered me to remove your NG tube. We've been monitoring your lab results very closely, and it looks like you've gained a lot of your nutritional value back. So your doctor has deemed that it's time to remove the tube, and you can start resuming eating normally very gradually. So is this okay with you? Do you give me consent? Yes? Okay. Do you have any questions or concerns? No? Okay, great. So I'm just going to raise the bed to a working height. I'm also going to place Miss Jones in a high Fowler's position, to remove the tube. I'm gonna open my gloves. I'm gonna place this down, but I'm going to stand by the patient while still maintaining all safety. First, I'm just going to remove the tape from her gown. And then I'm going to put the Chucks pad underneath the NG tube just in case anything spills. And I have an adhesive remover that I'm going to use to remove the tape. Alright, Ms. Jones, on the count of 3, I'm going to remove the tube. It's going to be very quick, but you might be a little bit of an uncomfortable feeling, okay? 1, 2, 3. Slowly and steadily remove the tube. Alright, great, Ms. Jones. You did great. Now I'm going to properly dispose of this in the proper trash receptacle. I'm going to remove my gloves. I'm going to also perform hand hygiene. I'm going to raise back her bed rail at the top. Lower her head of the bed just a little bit. And then I'm going to also document how the patient tolerated the procedure and also all the education that I did provide her regarding why the tube was going to be removed, as well as what she could expect during the procedure. And I would leave the room, perform hand hygiene.